Good day, everyone. Welcome to our virtual class. Please stand up for our prayer. In the name of the Father, of the Son, and of the Holy Spirit. Amen. Good afternoon once again. How are you feeling today? Are you all good? Did you eat your lunch? Do you feel the intense heat today? Then drink a lot of water. Always remember to stay hydrated. Now, I will be checking your attendance, but instead of calling your names one by one, I will just be asking your group leaders to stand and state the names of those who are not present today. Understood? Okay. Group 1, Group 2, how about the Group 3? Thank you. Wow, everybody is present. Before anything else, I want you to follow these 4 things in our entire discussion. These are the class rules. First, avoid using your cell phones. 2, avoid talking to your seatmates and peers. Third, if you have any questions, clarifications, then just raise your hand and I will entertain you. And lastly, respect me, respect us, your teachers, respect your classmates, respect everyone in the classroom. Are we all clear? Very good. Before we head to our discussion, let's have a game first. All you have to do is to guess the pictures that will be flashed on the screen. Understood? Okay? Picture number 1. How about number 2? And picture number 3. Very good. Those pictures are all part of the arts and creativity literacy which we have discussed last discussion. Okay, Miss Sisson, what have you learned from the past discussion? Thank you. Yes, indeed. The arts and creativity literacy helps students develop design, creativity, and critical thinking skills. Thank you. Now, I am asking everyone to please stand up and let us sing the song 5 Little Monkeys. 5 little monkeys jumping on the bed. One fell off and bumped his head. Mama called the doctor and the doctor said, no more monkeys jumping on the bed. One little monkey jumping on the bed. He fell off and bumped his head. Mama called the doctor and the doctor said, no more monkeys jumping on the bed. Thank you, everyone. Please sit down. Now, according to the song, whom did Mama call for help, or whom did Mama ask for help when her little monkeys fell off the bed? Who? It's the doctor. Very good. Why? Because the doctor knows how to what? The doctor knows what to do when someone is in pain or when someone is hurt. Very good. Now, my question is, what if the doctor isn't available? What will you do? Class, welcome to our new lesson, which is the health literacy. Okay, as you can see, health literacy is when individuals have the ability to gain access, understand, and use information in ways which promote and maintain good health for themselves, their families, and their communities. Being health literate doesn't only limited to knowing how to read medicine labels, pamphlets. No, it's not just that. It's more beyond than that. Because when you're health literate, you know how to address your health status, you know where to go or what to do when you're in pain or if you have concerns with regards to your health. Also, health literacy is the ability to obtain, communicate, process, and understand basic health information and services, which is correct because if you're health literate, then you really know who to call, what to do, and some basic information or even the basic medical terms that are used in terms of health. So it's not just buying medicine, over the counter medicine, knowing when or the the doses or the dosage of the medicine, but of course knowing when to, how to, what to do with regards to your health. Not just for your health, but of course the health of your family and your community rather. Now, health literacy, it is also written that mobilizing communities to address the social, economic, and environmental determinants of health. Because of course, there are factors that can affect one's health. It could be because of your environment, because of your status, or because of genetics, or could be also hereditary. So there are a lot of factors which can affect one's health. Additionally, taking care of our health is a part of our everyday life. It's not just visiting the doctors or going to a hospital or any clinic. Health literacy can actually help us in how to prevent diseases, protect our health, and better manage health problems when they arise. But there are actually health literacy issues because even people who can read comfortably or can use numbers comfortably don't really know or understand the key concepts of health. First is when they aren't familiar with medical terms or how their bodies work. Because there are actually people who are not familiar with the words or the terms that are used by the doctors or in hospitals, so they have no idea or the medicine, the kind of treatment. So it's not really, they don't really know the definition or the meaning behind those terms. And of course, how their body works. A lot of people also don't really know how their bodies work. They are not knowledgeable enough to understand, to determine that their bodies work accordingly. Then they don't have background or someone who could teach them about health. Number two, they are diagnosed with a serious illness and are scared and confused because of this issue. A lot of people rather choose to stay at home or treat themselves rather than going to doctors because they have their own beliefs, principles that they might get a lot of sickness or it may affect their whole being if they follow the doctors, if they use intake medicines. So they rather choose to treat themselves than to what? Than to ask or seek professional help from the doctors. Third, they have health conditions that require complicated self-care. A lot of people also believe that their conditions are not really serious or it's just gonna go away, the pain will just go away, so they'll just take care of themselves, rather than asking for professional help, which is kind of not good because of course when we're sick, especially that not really good, we must ask help from professional help, or we must go to a hospital or doctors because our condition might get worse. Because what? Prevention is better than cure. So those are some issues of the health literacy.
Alright. Next is empowering citizens. Improving health literacy in populations provides the foundation on which citizens are enabled to play an active role in improving their own health, engage successfully with community action for health, and push governments to meet responsibilities in addressing health and health equity. Meeting the health literacy needs of the most disadvantaged and marginalized societies will particularly accelerate progress in reducing inequities in health and beyond. The following are health literacy and the Sustainable Development Goals. First, no poverty. The levels of health literacy determines an individual's response to health information and their use of health services. Next is zero hunger. A good understanding of basic nutrition is essential to sustain a balanced diet and prevent all forms of malnutrition. A health literate parent will try to ensure that their children obtain the required nutrition for healthy growth. This will substantially enhance the impact of government policies and interventions aimed to prevent malnutrition and hunger across all relevant sectors. Next is quality education. A healthy child is less likely to have high rates of absenteeism from school. A health literate school administration can ensure that the school curriculum includes sessions on health education. Next is decent work and economic growth. A decent work environment promotes the level of health literacy of its workers through health education and ensures workplace policies protect staff. Next is industry, innovation, and infrastructure. The mobile revolution represents a unique opportunity to expand access to health information and communication, and therefore to enhance health literacy. However, governments need to ensure that the information provided is of high quality and that any private sector involved is free from any conflicts of interest. Are you still following me? Do you understand? Alright, let's continue with the two remaining SDG. Reduced inequalities. Health literacy predetermines the right to health. It is a tool for the most vulnerable population groups to ensure the right to health is respected. And the last, which is peace, justice, and strong institutions. Those with higher levels of health literacy are empowered to hold their governments to account, whether for access to essential medicines, universal health coverage, removing environmental air pollutants, or tearing down discriminatory laws and practices. Alright, do you have any questions with regards to this one? None? Then we'll proceed to another topic.
Now, let's try to test your knowledge. I have 4 situations here, and you have to guess if the person is health literate or not. Understood? Okay. I buy antibiotics without my doctor's prescription. What do you think? That person is not health literate. It's because you cannot just buy antibiotics without your doctor's prescription. Because antibiotics are not what? Over-the-counter medicines. That's good. How about number 2? Kindly read. That person is still not health literate. It's because even though that's just a small scar or scratch, it is still advisable for that person to see a doctor because we don't know if the cat has rabies or not, right? It's better to be what? Safe. Very good. How about number 2? That person is health literate. Okay, Mr. Arcaliana, can you please explain why? It's because even though that person doesn't know any ways on how to help his friend, he suggested to, yes, he advised his friends to seek professional help from a psychiatrist, which is good. And lastly, number 4, kindly read Miss Antonio. Yes, because that person knows and understands that eating junk foods is not really good for the health. Because why? What should you eat then? Healthy foods that are rich in nutrients such as vegetables and fruits. Very good.
I hope all of you are still willing to listen and to learn more about our topic. So, our topic is all about social and economic factors. So, this is just an introduction. Later on, Miss Catherine and Miss Alehan will explain more about the social and economic factors. So, what is social and economic factors? Social and economic factors affect how well and how long we live. Social and economic factors include such as income, education, employment, community, and social support. The choices that are available in a community are impacted by social and economic factors. These choices include our abilities to afford medical care and housing, and also to manage stress. Social and economic opportunities help communities to live longer and have healthier lives. For example, is living wage shapes opportunities for housing, education, childcare, food, and medical care. We do not always think about social and economic factors when we think about health. However, strategies to improve these factors can have a greater impact on health than strategies that target individuals' behaviors. Communities that have been cut off from investments or who have experienced discrimination have fewer social economic opportunities. These gaps disproportionately affect people of color and people living in rural areas. Children may be especially impacted. So, to learn more about social and economic factors, include education, employment, income, family, and social support, and also community safety. So, um, the next teacher will explain further about this topic, the social and economic factors.
And now, class, let us dig deeper to the topic social and economic factors. When we say social and economic factors, this passage discusses the various factors that influence our health and lifespan. It emphasizes that no single factor determines an individual's or community's health, but rather a combination of intersecting factors. The passage highlights four main health factors. We have health behaviors, clinical care, social and economic factors, and the last one is physical environment. Now let us tackle first the health behaviors. When we say health behaviors, these are health related practices such as diet and exercise that can improve or damage health. Health behaviors are influenced by the choices available in the place where people live, learn, work, and play. Access to nutritious food and exercise opportunities is crucial for making healthy choices. And the second one is about, yes, it is about clinical care. So when we say clinical care, this refers to the direct medical treatment or testing of patients. Access to affordable, quality health care is essential in preventing disease and detecting it earlier. Limited or low quality care can lead to delayed diagnosis and treatments, worse health outcomes, and shorter lives. So disparities in access to care exist based on race, place, and income. Understand? Okay. The third one is about social and economic factors. So these factors such as income, education, employment, community safety, and social support significantly impact health and lifespan. Social and economic opportunities play a vital role in promoting longer and healthier lives. For example, a living wage shapes opportunities for housing, education, childcare, food, and medical care. So these strategies to improve social and economic factors can have a greater impact on health than targeting individual behaviors. And the next one is physical environment, and this is the fourth one. And this factor is the quality of the physical environment, including air and water quality, housing conditions, and community safety, also affects overall health. Living in environments with clear air, safe housing, and a sense of community contributes to better health outcomes. And that is our last factor, and we are now done tackling about the four factors. So as a conclusion, it is important to address these health factors to create healthier communities and improve overall well-being. Strategies should focus on providing access to affordable health care, promoting healthy behaviors, improving social and economic opportunities, and creating a safe and supportive physical environment. Now, class, do you have any questions or clarifications about this topic? Okay, none so far. And now let us proceed to another discussion.
And now let's continue. What are the social and economic factors? We have here the first one, education. Why education is important in health? Because a person with a higher level of condition can lead to a greater sense of control over one's life, which is linked to a better health, healthier decisions, and fewer chronic conditions. So education is the reason why we have the knowledge in everything, especially in health. Education gives us the greater sense how to control or how to choose what is best for ourselves. For example, if a person is educated, he or she has the knowledge that eating vegetable and fruits and doing exercise is good for health. It helps the person to be a healthy person. And the next one is employment. So employment provides income. And once you choose your job or work, you need to have a working, safe environment that has a health insurance, paid sick leave, and also have the workplace wellness that together with your co-workers support each other and to have the opportunities to be a healthy. You have the healthy choices. So it depends on your environment for you to be a healthy person. And once you are healthy, you can live longer. And the next one is income. So income provides economic resources that shape choices about housing, education, childcare, food, medical care, and more. So why income is important in health? So as I said, it provides economic resources that you can choose where you can live. Also, where you can educate your future child. If you have a child, you can choose or you can give your child a care that good for your kids. Then food, of course. Once you have a stable income, you can buy the foods that you need. That foods that can help you to be a healthy person. That because being healthy can live you longer. And medical care. So it is very important to have a medical care because there are times that you don't know and you are the things that unexpected happen, especially in your health. So you need to invest and save money for in case of emergency. The next one is family and social support. So people with a greater social support, less isolation, and greater interpersonal trust live longer, healthier lives from those who are socially isolated. Having a family and social support, social connectedness influence our mind, body, and behavior, all of which is influence our health, life expectancy, because family and friends support can lead us to live longer, better health, and improve our well-being. And the last one is community safety. So why community safety are important in health? Because it reflects not only violent acts in the neighborhoods and houses, but also injuries caused unintentionally through accident. Community safety is about helping communities to be and to feel safe. And you are assured that you are living in a safe community. It is very important that you feel where you lived, work, or spend your leisure time. There are ways that you can get involved to help improve your safety of your own community. And those are the social and economic factors. And now, let's proceed to the next topic.
Good day, class. Now we will proceed with health systems and practices. Now may I request you to please read. Thank you. And now to expound, World Health Organization is to support the goals of improving health and health equity. And now, let us proceed with 6 building blocks.
Okay, now we're delving into a topic that affects each and every one of us, which is the health systems. Now, when we talk about health systems, what exactly do we mean? So, according to the World Health Organization or the WHO, a health system encompasses all organizations, people, and actions whose primary goal is to promote, restore, and maintain health. Essentially, it's everything that's in place to keep us healthy, to fix up when we're not feeling well, and to make sure everyone has access to the care they need. Okay, this definition is crucial because it highlights the importance of not just treating illnesses, but also preventing them in the first place. So, it emphasizes the idea of health equity, ensuring that everyone has a fair opportunity to be healthy regardless of their background or financial status. Now, to understand more about health systems, we can break them down into 6 key building blocks. So, the first building block is the service delivery. So, service delivery refers to the provision of healthcare services to individuals and communities. So, in the Philippines, service delivery encompasses a wide range of facilities from primary health centers to tertiary hospitals. So, an example for this is the barangay health centers in rural areas. They provide primary healthcare services including consultations, vaccinations, and maternal care, catering to the immediate health needs of local residents. Now, the second building block is the health workforce. So, health workforce comprises professionals and support staff who deliver health services. So in the Philippines, this includes doctors, nurses, midwives, pharmacists, and community health workers. So an example for this is the community health workers or the CHWs. They are instrumental in rural areas where access to healthcare facilities is limited. They provide basic healthcare services, health education, and promote preventive measures within communities. Okay, now we're in the third building block, which is the information. So, information systems facilitate the collection, analysis, and dissemination of health-related data. So this data is crucial for informed decision making and planning within the health sector. So an example for this is the Philippine Integrated Disease Surveillance and Response or the PIDSR system monitors and tracks diseases outbreaks nationwide, enabling timely response and containment efforts. So the fourth building blocks is the medical products, vaccines, and technologies. So, the access to essential medical products, vaccines, and technology is vital for the effective delivery of healthcare services. This includes medications, diagnostic tools, and medical equipment. So an example for this is the Philippine Department of Health or the DOH. They ensure that the availability of vaccines through the expanded program on immunizations or the EPI, which provides free vaccines against diseases such as measles, polio, and tuberculosis, and even the COVID-19 vaccine is provided for us like before, like during the pandemic, right? Okay, now we're down to the fifth building blocks, which is the financing. So, financing mechanisms ensures that the health system is adequately funded to provide essential services. This includes government funding, insurance schemes, and out-of-pocket payments. So, an example for this is the Philippine Health or the PhilHealth, the National Health Insurance Program in the Philippines. So, they provide financial risk protection to its members by covering a portion of their medical expenses. Okay, now we're in the sixth and last building block. So it is the leadership and governance or the stewardship. Sorry. So it is an effective leadership and governance are essential for guiding and regulating the health system. So this involves policy development, regulation, and accountability mechanisms. So an example for this is the Philippine Health Agenda or the PHA. So they sets out the government's priorities and strategies for promoting or for improving health outcomes, guiding the efforts of various stakeholders in the health sector. So each of these building blocks is essential for health system to function effectively. So they work together to ensure that people can access the care they need when they need it and that resources are used efficiently to improve health outcomes for everyone. So as we explore the world of health systems, keep in mind these 6 building blocks and how they all come together to support our well-being and promote a healthier society.
Thank you for the 6 building blocks. And now, let us proceed with health practices. Again, may I request you to please read. Thank you. Now, can you please give us an example or to expound about health practices? That is right. Now, let us proceed with health practices can include lifestyle choices and such as regular exercises. Now we are aware of exercises just like aerobic exercise. Next is balanced nutrition. Do you have any idea about balanced nutrition? Exactly. Eating your vegetables, eating your fruits, proteins, and etc. How about adequate sleep? Yes, a person must sleep to 7 to 9 hours. And next is stress management, which are meditation and breathing exercises, and many more. And next is mental wellness activities, such as therapy and again meditation. And next is avoiding harmful habits, which are, do you have any examples or ideas? Yes, one of them is smoking and drinking alcohol. And next is social connections. Do you have any ideas about social connections? Yes, spending time with your friends, with your family, which is maintaining relationships. And next is environmental health. Do you have any idea about environmental health? Yes, avoiding pollutants at any cost, making your living space clean and maintaining it, of course. And the last but not the least, regular relaxation and recreation. Do you have any idea about that? Yes, watching movies, going on vacation, doing your hobbies. Exactly. Now these are the healthy practices that we go on to make a healthy lifestyle. And class, that is for health systems and health practices.
Alright, let's proceed with another subtopics, which is the common elements, causes, and its treatment. First on the list, we have the allergies, which are an immune response triggered by allergens, an ordinarily harmful substance. Causes: people with allergies have especially sensitive immune systems that react when they contact allergens. Common allergens include foods such as nuts, eggs, soy, shellfish, pollen, mold, latex, pet dander, and many others. The most and easiest effective way to treat allergies is to get rid of or avoid the cause. For example, if you are allergic to dust mites, make an effort to keep your room clean and free of dust by frequent vacuuming, dusting, and washing of bedding. Note that some allergies go away with age, but others are lifelong. Okay, are we good? Are you following me? Alright, let's proceed to another ailment. The colds and flu. Colds and influenza, or the flu, are the most common illnesses among college students. The cause of this Both of these illnesses are upper respiratory infections, meaning they involve your nose, throat, and lungs. Viruses cause both colds and flu by increasing inflammation of the membranes in the nose and throat. Most transmission of these viruses occurs via hand-to-hand contact. If any problem is causing you discomfort, you should seek medical care. Seek medical attention promptly if you have the following, such as a fever of 102 degree Fahrenheit or greater, which may indicate a more serious infection. Next is a persisting cough, especially with a significant fever, which could indicate pneumonia. And then what else? A persistent sore throat, especially if runny nose does not develop, which could indicate a strep infection, or any cold that lasts 10 days, because colds and flu are caused by viruses. They cannot be cured by antibiotics, right? Do you have any questions or clarifications? None? Okay, number 3 is about conjunctivitis, pink eye. An inflammation of the transparent membrane, which is the conjunctiva, that lines your eyelids and part of your eyeballs, has several possible causes. It could be a bacterial or viral infection, an allergic reaction to pollen or animal dander, or a result of chemical irritants such as smoke, chlorine, lens solution, and many others. Because pink eye is highly contagious, early diagnosis is important. Bacterial cases can be cured with antibiotics, eye drops. Viral conjunctivitis clears up on its own, and allergic reactions can be treated with various types of eye drops. Here are some general tips. You must wash your hands frequently to prevent spreading an existing infection to your other eye and to other people. Next, don't rub your eyes. Instead, use a cool wet washcloth to soak off any crusting. Use a warm or cool compress to reduce discomfort, and then use clean towels and pillowcases every day. You must avoid wearing contact lenses and discard current lenses. If eye drops are prescribed, place drop in packets formed by pulling down lower lid. Make sure you don't touch the battle of the eye in order to prevent contamination. If the infection does not improve in 2 to 3 days, make an appointment for re-evaluation. Alright? Is it clear, class? Okay, let's proceed to number 4. It's about diarrhea. Usually, diarrhea will clear up on its own in a day or two, but a prolonged case may cause complications. The most important concern is dehydration. I'll give you an advice for taking care of diarrhea yourself. You need to avoid foods that are milk-based, what else? Greasy, high fiber, or very sweet, because these are likely to aggravate diarrhea. Also, you must avoid caffeine and alcohol. Instead, drink about 2 cups of clear fluids per hour if vomiting isn't present, such as sports drinks and broth. Because if you drink water alone is not enough, because your body needs sodium and sugar to replace what it's losing. Also, you must avoid high sugar drinks like apple juice, grape juice, and soda, because this can pull water into the intestine and make the diarrhea persist. As I've searched on the internet, I've read on the internet that some doctors suggest the broth diet, which includes foods that are low in fiber, fat, and sugar. Broth stands for bananas, rice, applesauce, and toast. Alright, so do you have any questions? Are you following me? Do you understand? Alright, so do you have any questions or clarification with the first 4 ailments? None? Okay, now Ms. Tabunan will discuss further the 3 remaining ailments.
Thank you, Teacher Jasta. Let's have a continuation of the common ailments. The first cause, this is emotional and physical stress, which is correct because our bodies react to stressful events with fight or flight response. This involves release of certain chemicals that can cause physical changes, such as in the blood vessels. This, in turn, can bring on tension headaches. For example, when you cry, you can actually feel the tension of your muscles. They tense up, especially in your jaw, down to your neck, and at the back of your head. And if you cry in a prolonged period, the continuous contractions of your muscles may what? It will cause a tension headaches. The second cause of it is fatigue. Fatigue means you feel exhausted, you feel tired, you feel burnout. And that is another cause of headache. The next one is irregular sleep habits. Sleeping too much or too little. For example, if you're sleep deprived, your brain doesn't have enough time to rest and repair itself. So the moment you wake up, you feel a very tense feeling here in your temple or in your head. That's because you lack of sleep. Next one is skipping meals, which is very understandable because we are always reminded by our professors, by our instructors to never skip meals, especially breakfast, because the moment we eat our breakfast, especially rice, it gives us carbohydrates, our source of energy when we go to school, especially that we have team sports subjects. Okay, next one is hormonal factors such as menstruation. Why? Why do you think menstruation can also cause headache? It's because this is mainly triggered by hormonal changes. And these changes can also what? Because of these hormonal changes, our estrogen levels may drop just before menstruation. And this drop can affect brain chemicals and blood vessels, leading to headaches. So, the treatment of this ailment, headaches, you can actually hold an ice pack over your eyes, no, or over your forehead to lessen the heat or tense there. And you can actually take a bath or half bath. Just make sure that the water is not too cold, the water is not too hot, and you must also sleep or at least rest in a dark room so that it may not trigger your stress when you're about to sleep. Let's proceed to the next common ailment, which is the mononucleosis. I know that a lot of you here are not familiar with this term, but mononucleosis is a viral infection that causes fever, sore throat, and swelling of lymph nodes and neck. And what causes this? It's because of Epstein-Barr virus. Epstein-Barr virus is one of the 9 known herpes virus in the herpes family, and it is one of the most common known viruses in humans. So where can we get this kind of illness? Actually, the virus can actually spread through saliva. It's not really only because of sex, or it isn't really not sexually, or you cannot actually get this because of sex, but also you can get this illness through saliva, especially when you share with your friends who have this illness and you share common kitchen utensils such as glass, glass, spoon. No, so if you know someone who has this illness, so you must stay away. I mean, you must um, use your own utensils for your safety. So since mono, it is a virus, so antibiotics cannot actually treat this or cure this illness. All you have to do is you have to drink a lot of water, get some enough sleep, and eat healthy foods. And our last common ailment is stomach aches, which is also called abdominal pain or belly aches. These are discomfort or pain in the area between the chest and the pelvis. They can vary in intensity and may be caused by various factors such as constipation, menstrual cramps, diarrhea, or ulcer. So, the treatment of this also depends on the factors or cause of it. So, for example, um, from cramps, from cramping to diarrhea, you can actually buy over the counter medicines such as loperamide for you to feel better. And those are the 6 common ailments and their causes and treatments.
Good day, everyone. I am teacher James Daniel C. Liguayan. Today, I will be your teacher. Now, we will be discussing about first aids, the hows and the benefits. And we will be discussing about the benefits of first aid. So, first one on the list, it can save lives. So, when performing um, first aid, we can save lives by performing the correct and sa tamang gawain kung paano gawin ang first aid. Like for example, may insidente, saka na-choke yung isang pasyente. Tapos, sa paggawa mo ng simpleng first aid, you can save lives. So, number 2, prevents worsening of injury. Like for example, if an athlete is injured, like for example, his foot landed to the defender's foot and yung paa niya ay namaga. So, pag nilagyan mo ng ice yung paa ng isang injured na player, magiging komportable siya, at saka it can prevent the injury to become worse. Number 3, promotes recovery. So, kagaya ng example ko kanina, like what I said earlier, aside sa magiging komportable yung isang pasyente, magiging madali lang din ang pag-recover ng isang pasyente sa pag-apply ng first aid at by applying it the right way of giving the first aid. And number 4, reduces pain and discomfort. Kagaya din ng aking example earlier, by applying first aid, it reduces the pain and discomfort. So, pag maglalagay ka ng isang first aid sa isang injured na player, sisiguraduhin mo talaga na yung ginawang first aid is helpful sa kanya at para maiwasan din yung discomfort ng isang pasyente. And last one is minimizes complications. And by applying ice on that particular leg or injured foot of the player, it minimizes the complications. Like for example, pag hindi naagapan yung injured na paa, maaari itong mamaga na sobra. And by giving first aid of that, like for example, soaking your injured foot in full bucket of ice, ng ganon. At it minimizes complications. So, naintindihan ba? Diyan, sa labas, sa likod, naintindihan ba? Okay. Now, we will be moving forward. And I will be teaching you how to properly execute CPR. Today, I have a friend who can help me to demonstrate how to properly execute CPR. So now, first is check the scene and person if you believe that you are witnessing a medical emergency. Your first step should be to confirm that the scene is safe and it is okay for you to approach the patient. So, for the first step, tsaka ka lang lalapit sa incident if yung lugar na pupuntahan mo is safe na. Kasi kapag harmful pa yung lugar, imbes na ikaw ang mag-rescue, baka dalawa na kayong i-rescue. So, check the surroundings first. And then, the second step is call local emergency number. CPR isn't a substitute for emergency medical care. And it's essential to ensure that you get an ambulance on the way as quickly as possible by calling near care as soon as you have confirmed that you are, in fact, dealing with a medical emergency. So first, ang una mong gagawin is, kung saan malapit yung lugar na pwede kang magtawag ng ambulansya, doon ka magtawag. Like for example, if the incident has happened inside the school of Central Mindanao University, yung ambulance na tatawagan mo is yung sa University Hospital, which is located to our school. So, gets ba? Okay. Step number 3. Open the airway, place the patient on their back, then tilt their head backwards to open up their airway. This will make it easier to check for breathing in the next step. So, when there is an injured person, kagaya nito, from this position, ganito na yung position niya. Tapos, sisiguraduhin mo na nakakahinga talaga yung pasyente. And tilt their head backwards and open up their airway. For the next step, check for breathing. Place your ear next to the patient's mouth and listen for breathing. It's important to note that the occasional gasp does not count as breathing. So, if this is the patient, you must place your ear into his mouth to check if he is breathing. Like that. And for the fifth step, perform chest compression with its perform chest compression. When performing chest compression, it's essential to push hard and push fast. You will want to perform chest compressions that are at least 2 inches deep and deliver them at rate of around 100 compressions per minute. Then, when you perform the CPR, check his rib cage first if it is not injured, because kapag di mo chine-check yon tapos may bali pala doon, mas imbes na mag-a-apply ka ng CPR, mas ma-worse pa yung scenario. So kapag wala namang injury or hindi injured yung patient, ang pagtamang gawa dyan is yung dominant hand mo is over yung weak side na weak hand mo. This one. Then, at least push 2 inches like this. Like that. 2 inches deep from the patient. And step number 6. Deliver rescue breaths with the patient's head tilted back and their chin lifted. Pinch their nose, shut using your fingers, then place your mouth over theirs, creating a tight seal. Then, in this example, you will rescue the patient mouth to mouth. If you have an ampo bag, like it's tool that helps the patient to breathe easily. But when you don't have that tool, you will rescue the patient mouth to mouth. So when you perform mouth to mouth rescue, you must pinch the nose and then place your lips to the patient's lips to give him a rescue breath. That's what we call rescue breath. And then the last step. And the last step. Repeat the process. Repeat steps number 4, step 5, and step 6 until the patient shows signs of life, until professional medical help arrives. So, if the medical help not yet arrived, you will perform the step number 4, step number 5, and step number 6. Because the only yung ginagawa mo ay palandalian lang na kanang relief sa isang pasyente. And mas mabuti na at mas maigi na may ambulansya na a-assist sa iyo at saka magsisecure talaga na safe yung pasyente. And then, if you deliver chest compressions, you give it 30 times. Like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 8, 9, 13. And then you give 2 rescue breaths. You will repeat that 3 times. And then, if the patient is responsive and he is responsive na, you place his knee like this and like that, and pat his back if he is responsive na. I guess you na subaybayan niyo naman ang aking example. So thank you for that one, Sir Dave. Okay, thank you. Any questions about my demonstration? Okay. If none, I will give you an activity. So, find your pair and perform CPR. The correct way of performing CPR. I will only give you 5 minutes to practice, and I will select 5 random students to present here in the front. Okay, are you ready? Okay. Time is up. Okay, very good. I guess that's my part. Okay, thank you.
So thank you for that. In this juncture, we'll be discussing about 5 the most dangerous drugs abuse and its treatment. And we have here 5 dangerous drugs or commonly drugs that been abused that might as teens can relate. First is alcohol. No surprise because alcohol is a readily available drugs, and 25% of underage drinking this drug. So it is no wonder if it is the number one drug been abused. Because bakit kaya marami sa mga teenagers or underage adult ang umiinom nito? Because sabi nila, they want to forget their problem at the moment. They want to feel enjoying because alcohol is a CNS depressant. That's why, right? Get it? Alright, and now let's proceed to number 2, marijuana. Marijuana is like a leaf, right? And it is harmless, and it is being used as a medicine, but today, because of people abusing it, it causes psychosis. Psychosis is a symptoms of hallucination. So when you take marijuana, abusing marijuana, you will feel hallucinate, delusion, and headache. There is many symptoms of taking marijuana. Alright? Prescription medication. Yes, most of us really abuse this drugs because we all know that it is prescribed by doctors. So we think that it is not harmless, but nothing further from the truth. Right? That's why people mistaking this drugs and misuse it. That's why we have drug abuse. Alright. Next is over-the-counter substance. This is where people can directly be sold or buy it. So no wonder that these drugs will be abused because people nowadays only want instant in life. So what availability we have, so that those are the medicine we must take. Even if we don't know the consequence of taking that thing, we know. Alright. So that is over-the-counter substance. The substance or drugs that we can directly get or sold by people. Alright. Next is spice or aka keto. It is a synthetic marijuana. It is marijuana that is being human-made. So it is far from natural. So which means that it is more harmful than marijuana. It can cause, and symptoms of this is also hallucination, delusion, fast heartbeat, and etc. So those are the 5 commonly drug abuse that been that as teens or mostly teens abusing it. So, any question, clarification about this thing? Alright, if not, let's proceed to our next topic.
Good day everyone, I am teacher Raymar F. Abello and this is the continuation of Ma'am Jolina's discussion. So I will gonna discuss the treatment of dangerous drug abuse. So there are 5 treatment of drug abuse. So first is treatment programs, withdrawal therapy, behavioral therapy, self-help groups, and ongoing treatment. So first is treatment programs. So treatment programs can vary widely depending on the specific condition or issues being addressed. They can include therapy, medication, support groups, lives change, and more. It is important to tailor the program to the individual's need and to seek guidance from qualified professionals. So what type of treatment program are you interested in? And the second one is withdrawal therapy. So withdrawal therapy is typically refers to the treatment process for individuals who are experiencing withdrawal symptoms when discontinuing the use of substances such as alcohol, drugs, or medications. Withdrawal therapy often involves medical supervision to manage the physical symptoms of withdrawal such as nausea, tremors, or seizures, as well as psychological support to the address and cravings and emotional distress. And the third one is behavior therapy. So behavior therapy, it is a type of psychotherapy that focuses on identifying and changing unhealthy or maladaptive behaviors. It is based on the principles of learning theory, particularly classical on operant condition, and emphasize the role of environmental factors in the shaping behavior. So behavior therapy techniques might include the behavioral modification, systematic desensitization, cognitive behavioral therapy, and exposure therapy, and the last one is token economy. So behavior therapy is effective of a range of conditions, including the anxiety disorders, phobias, obsessive compulsive disorder or OCD, and depressions, and substance and use and to use of disorders. And the fourth one is self-help groups. So self-help groups are community-based organizations formed by individuals who share a common concern, conditions, or experiences. These groups provide mutual support, encouragement, and information sharing among members to address shared challenges and goals. Self-help groups can cover a wide range of topics, including addiction recovery, mental health, chronic illness, grief support, and more. So, some key features of self-groups include the peer support. So, peer support members provide each other with empathy, understanding, and encouragement based on their shared experiences. And the second one is shared experiences. So members can relate to each other's struggles and tantrums, which can reduce feelings of isolation and stigma. And the third one is information sharing. Members exchange practical advice, coping strategies, and sources related of their common concern. And the fourth one is empowerment. So self-help groups empower members to take an active role in managing their own well-being and making positive changes in their lives. So however, they can implement formal treatment and provide ongoing support for individuals in recovery or coping with the challenging life of circumstances. And the last one is ongoing treatment. So ongoing treatment refers to the continued care and support provided to the individuals after they have completed an initial phase of treatment or therapy. It is essential for maintaining progress, preventing relapse, and promoting long-term well-being. Ongoing treatment can various forms depending on the individual's needs, the nature of their condition, and the recommendation of healthcare professionals. So including of this is therapy sessions, medication management, support groups, lifestyle changes, follow-up appointments. However, this treatment is often tailored to the individual individual's specific needs and may involve a combination of the above approaches. It is crucial for individuals to actively participate in their ongoing treatment plan and communicate openly when their healthcare provides to the insured that their needs are being met effectively. What I mentioned earlier, there are 5 important treatments of dangerous drug abuse. So each of these treatments plays a crucial role in addressing dangerous drug abuse, and together they form comprehensive approach to recovery, the long-term well-being for the individual struggling with the addiction. However, by addressing the physical, psychological, and social aspect of addictions, so these treatments contribute to a comprehensive approach to recovery that can significantly improve that the well-being and quality of life of individuals struggling with a dangerous drug abuse.
Good morning, everyone. I am teacher Hazel, and for today's topic, we will be discussing about the health risk elements and how to avoid them. So here's the definition. A health risk is the chance or likelihood that something will harm you or otherwise affect your health. Risk doesn't mean that something bad will definitely happen. It's just a possibility. Well, of course, risk does not necessarily mean that bad things will happen to you. It is merely a possibility that could potentially harm your health. Alright, so the next one is how can you prevent chronic diseases? Number 1, you must eat healthy because as a young adult who eat a healthy diet live longer and have a lower risk of obesity, heart disease, type 2 diabetes, and certain cancers. Healthy eating can help people with chronic diseases because it can manage these conditions and avoid complications. And the second one is get regular physical activity because besides helping prevent many long-lasting conditions, regular physical activity can help make life better for people who have them because a complete program includes exercise that raises the heart rate, builds muscles, and helps keep joints moving well. Exercise that raises the heart rate is known as aerobic exercise. The third one is avoid drinking too much alcohol because over time, excessive alcohol use can lead to the development of chronic diseases and other serious problems including high blood pressures, heart disease, stroke, liver disease, and digestive problems. And the fourth one is get enough sleep because sleep repairs our damaged cells and gives us the energy we need to live a healthier life. Because having a chronic disease can be a very challenging. Sometimes it can be overwhelming to think about the many factors that affect your health. So getting a good night's sleep can help the first step in managing your conditions. And this is the end of the part of my discussion. Thank you for listening, class.
Okay, class, for the next topic, it is all about health management. So, what is health management? Health management is a profession that involves the oversight, planning, direction, and administration of healthcare system, facilities, clinic, and hospital networks. Examples of health management roles includes healthcare finance manager. So what is healthcare finance manager? Healthcare finance manager are typically responsible for day-to-day financial operation of a hospital, clinic, physicians group practice, and managed care. The next one is healthcare department managers. So healthcare Department managers supervise or conduct the recruitment, hiring, scheduling, and training of staffs in the department or facilities they direct. The next one is a research management. So research management is a board field involving a coordinations of numerous processes to move research efforts forward from setting goals and obtaining approval to monitor the progress and ensuring compliance. The next one is clinical directors. Clinical directors have their hands in nearly every aspect of hospital or clinic operations, from supervising the staff to managing budget to ensuring the clinic follows all states and federational regulations. The next one is, and the last one rather, is healthcare administration. Healthcare administration describes leadership roles held by manager in hospitals, nursing homes, insurance company, and medical offices. In this setting, healthcare managers holds a broad range of responsibility, including operations, finance, management, policies, strategies, and more. And also the daily tasks and skills in health management includes workforce recruitment and training, facility management, managing internal communication between staff and department's head, and the last one is improving medical services. Examples of different type of healthcare management includes healthcare consulting. So what is healthcare consulting? So healthcare consulting provides health organizations with professional guidance spanning a wide range of services that may include manufactured goods, mobile devices, information systems, and retails. The next one is health insurance underwriters. This is a process used by insurance company to figure out your health status and also to determine whether to offer you coverage, at what price, and with what inclusion or limits. The last one is clinical management. So clinical management is an approach to decision making about all aspects of patients' care. And for the benefits of health management, it includes structured care system, cost controlled, better clinical care. Any questions, clarifications? If none, I will give the floor to Teacher Jackie.
This is a continuation to Miss Taghoy topic. It's all about health management and lifestyle. Her part is all about health management, and my part is about health lifestyle management. Okay, for you to know about or to have a healthy lifestyle, I will explain to you how to have a healthy lifestyle. Maintaining a healthy lifestyle. If you're looking to maintain a healthy lifestyle, small changes are the best way to get started. I will share to you about these 7 easy ways to keep you or to give you or to have a healthy lifestyle. So first is eat a healthy balanced diet. Second is have regular meals. Third is stay hydrated. Fourth is don't rely on comfort food, alcohol, cigarettes, and the like to relieve stress. Fifth is keep active wherever possible. Six is sleep well. Seven, don't be too hard on yourself. For you to learn more, to have an idea about the easy ways, I will explain further to you my topic. So first is eat a healthy balanced diet. So much of maintaining a healthy lifestyle is about having a healthy balanced diet with plenty of fruit and vegetables. Eating well is one of the best way to look after your health. Many people underestimate the importance of a healthy diet, but proper nutrition can improve everything from your energy levels to your mental health. It is clinically proven that eating junk foods regularly can impact your body and mind, increasing the likelihood of depression and anxiety. So, for you uh, to have a healthy lifestyle, avoid eating junk foods, start eating healthy foods like vegetables and fruits. Second is have regular meals. Skipping breakfast or lunch can really affect your ability to concentrate and work productively, as can replacing your breakfast with countless cups of coffee. You may find yourself getting headaches or feeling very sluggish. So most of our routines have been disrupted by the crisis, meals times included, but to try to stick to regular times and take a proper break for lunch whenever possible. So, for you to have a healthy lifestyle, please avoid skipping your meals. Third ways to have a healthy lifestyle is stay hydrated. Drinking enough water is a crucial part of healthy living. According to Association of UK Dietitians, they show that drinking enough water can help you lose weight. So drink more clearly and avoid stress among many other benefits. Fourth is don't rely on comfort food, alcohol, cigarettes, and the like to relieve stress. So if stress makes you turn towards salty and fatty foods or causes you to overeat, you're not alone. Similarly, many of us try to manage our anxiety with alcohol or cigarettes. These things may all offer temporary relief, but in the long term, they'll make you feel worse. Don't deprive yourself completely, but try to stick to healthy choices most of the time. Fifth is keep active wherever possible, or have a regular exercise will make you feel so much better and is crucial to staying healthy. Sixth is sleep well. Sleep is often one of the first things to suffer when our routines change. Try your best to keep your regular sleep hours and to ensure you're still getting 7 to 9 hours a night. Getting enough sleep improves your overall health and protects your mental well being. So stop staying late at night. Try to sleep early. To you to have a healthy mental well being. The last one is don't be too hard on yourself. Sometimes you'll have bad days. You'll feel rubbish or you'll make unhealthy choices. It's not the end of the world. Nobody's perfect. Change doesn't happen overnight. Bear that in your mind. This is a really difficult time for everyone, so try to go easy on yourself. Again, for you to achieve the to have a healthy lifestyle, don't don't be too hard on yourself. Just follow the step by step. Don't be on rush. Okay? So that's all. I hope you understand my topic. Again, for you to have a healthy lifestyle, just follow these easy steps. Um, and if you follow these steps, I believe that you will get a healthy or you will manage your lifestyle. That's all, and thank you.
Okay, to test your knowledge on health literacy, you are about to form 10 groups with 4 to 5 members each. I would like you to perform a drama or a role play that would include a demonstration of the proper steps of CPR. This activity will help you to be prepared for whatever challenges may arise in emergency situations, equipping you with the skills to potentially save lives. Attached below is the rubric for your presentation, so kindly read it. As for your evaluation and assignment, it will be announced this Monday during our class. We, the team teachers of Group 4, would like to thank all of you for your participation and cooperation in this virtual class. Also, we would like to thank Ma'am Vivian for this opportunity to enhance our skills in communication and for our teaching skills. I hope that you have understood the key concepts of health literacy and how important one's health. Once again, thank you so much, and do not forget to drink your water. Stay hydrated, everyone. Thank you.